Hey, what's up guys? Vito Romantine here again for another social work video. I was so pumped up after my last one. We went over some of the history of social welfare that I wanted to dive right into another video. I couldn't wait any longer because if this is your first video with me, again, I say this in all my videos just so we're on the same page. I love social work. I think that helping people and being able to advocate and be there for other people is so important because sometimes they just lose a voice. So to understand all that, we've already made a video on the history of social welfare. We've gone over some current social welfare programs. And like I said, I was so pumped up that I wanted to make a video on advocacy and policies and things of that nature. I think that advocacy is so huge and why it's so important is, as I just said a minute ago, is that sometimes people lose their voice and it takes a whole group or a bunch of people working together to voice that opinion or give that cause or the need some legs, right? For lack of a better term. People need help. That's why we're here. We are a helping profession. We are here to aid and help others. So I took some time, some research, and I was on the National Association of Social Workers website. That's NASW for short. I was on their website and I was looking up some policies and things of that nature. And one thing that really caught my attention is something that, we talked about the history, we talked about the programs, and in the programs we go into the food, the housing, the money, things like that. But one thing that I think is lost in all this is mental health and substance abuse disorders. Sometimes someone with a mental health disorder or substance abuse disorder, whatever form that may take, may lead them to be in low income or give them barriers that will restrict them from being able to become who they are or live up to their full potential. So as I was looking through their website, again, it's the National Association of Social Workers, there is a whole section on policy and advocacy. But one thing that really caught my eye was this thing about mental health and substance abuse. And I just wanted to share with you guys what they're working towards and what they're going on. And this came right from the 2021 Blueprint of Federal Social Policy Priorities. And what that is there's people that are actively working with legislature up in the Capitol to push for these motions, push for these policy changes, push for these acts or these laws that get put into place. And one of them that is dear to me and why I do this really is because of mental health and substance abuse. So I wanted to take a moment and share with you what they're working on right now and what's going on. Because this is not about why the problem is. It's about promoting wellness and education and relapse prevention, right? Because we can learn about why, but what do we do to make the change? And we're in the helping profession. So just a little bit of numbers for you that I was reading on the website here. In 2018, approximately 7.8% of people over the age of 12 needed substance abuse treatment. That's a pretty large number for the population we have here. Drug overdoses are on the rise. And then 5.6% of Americans over the age of 18 have an alcohol or substance use disorder. They are diagnosed with this. Sometimes, just as a side note, sometimes mental health runs concurrent with a mental health diagnosis, runs with a substance abuse disorder, whether the individual is using these chemicals to treat their mental health or mask their mental health or make them feel better is a different conversation, but I thought it was worth mentioning. But some of these things with this substance abuse disorder, it leads to the highest rates of suicide we have right now in our country, major health problems within the body, and like I said already, it can negatively influence mental health. In 2008, the Mental Health Parity on Addiction Equity Act required all health plans to cover mental health and substance use disorders. I'm sorry, I keep messing that up, but it is difficult though because states do still have some control over what they will cover and what they won't. So what I'm getting at, and all of that I'm saying, is to come to this, where the National Association of Social Workers are up there fighting right now for some changes to be made. And some of those few changes are they're calling for more permanent use of telehealth due to the COVID-19 pandemic. Telehealth was really huge and instrumental because the whole country shut down and people were left in the dust. You know, sure, everybody was, but mental health and substance use took a hit, a real big toll. Investment in further development of the National 211 dialing number. It's a community resource information number. They want more money to be put into that. Adequate funding of prevention of substance use disorder and mental health diagnosis. We need to expand community supports. And then I like this one too here. It's to pass a comprehensive addiction resources emergency act, which will provide emergency assistance to funding areas that are most affected by opioid crisis so people can get the help that they need, right? The funding has to be there. And then also to fund social workers and other healthcare providers to promote the expansion of mental health awareness and education in our school system. And they want this to start at kindergarten all the way through 12th grade up into higher education. With the awareness, we are able to help more people. Again, I think it is so important that there are people out there fighting for this, and I want to join that cause. So I want to take a moment and really put this directive into what we're missing and how we need to help people. And I'm going to do that, and I'm going to do it through leadership and hope that others will follow. Again, social work is about helping others. So let's get out there and help some people, guys. We'll catch you on the next one.